Okay, so here today I'll be talking about Trendelenburg gait or glutes medius gait. So we'll take an example. This is your hip bone, and on top of that sits your lumbar spine. So whenever there's an instability on your hip, it can cause position change in your lumbar spine or mobility change in your lumbar spine. If a patient is suffering from disc bulge, it can cause more impingement or more the disc to move or shift from its place. So this glutes medius placed on your lateral aspect of your hip. Medius plays a very important role in stabilization of the hip. Suppose one side of the glutes medius is weak, it tends to drop the opposite side. There is a pelvic drop in the opposite side. So it can happen due to lack of mobility in your hip. Due to lack of mobility, there won't be sufficient movements for the muscle to stretch or move around, and over the time they can get weak. We'll take an example. So there is a band here. So muscle has the property to stretch and contract. Suppose then there is no movements in the hip. Either they'll be in a little bit stretched position or the contracted position. They won't have contract relax. So due to lack of sufficient movements in the hip, there won't be this kind of contraction of the muscles, and over the time it can get weak, and after that weak it can cause this type of gait, which as you can see in this video. So strengthening those glutes medius is very much important for the stability of the hip, and overall muscle gets strengthened. So I'll give you some exercise which will help you for strengthening your glutes medius. Very simple and easy to do.